Welcome to the Action Drug Rehab Hour. I'm Cary Quashen, and I am your host. I got a co-host today, though. How are you today?
I'm doing well. My name is Jade and I am the
Duh.
KHTS
Everybody knows
director.
that, Jade.
Oh, I like to think of myself as like D-level Santa Clarita celebrity at best.
At best. Well, no. I was saying I'm in the office with a superstar. So no, I mean, all joking aside, today I really want to get serious because I'm so freaking tired of dealing with what I'm dealing with. I mean, every time I pick up my freaking phone and I go to Facebook, somebody's sending me a message that somebody died, and it's daily now. And I just want to just show you this one, and then you'll see what's upsetting me so much. I'm not going to mention the name and the picture you could see.
Yeah.
I mean, it's so sad. It says, "Hi, Cary, I'm the mother of. I'm heartbroken to tell you that he passed away October 25th to a drug overdose. Another young, beautiful soul lost to fentanyl." Now, that was about 2 weeks ago. I got another message from the same mom Friday. And here's what it says. "My daughter passed away December 10th. I can't believe this is happening. I'm devastated."
Of course she is.
How do you deal with this? This is two of her children. And the sad thing is, this isn't the only mom that sent me stuff like this. I had one message where the son died, then the dad died. With the same freaking pills.
You're talking about entire families not just being destroyed, but decimated, and entire family lines ending because of counterfeit, harmful drugs.
This is insane what we're dealing with right now. I mean, what do you say to a mom or a dad that just found their 16-year-old kid in bed dead? Think about that. Do you know how many of those mom and dads I deal with?
Yeah, you've been doing this for close to 40 years?
Yes, don't tell anyone. That's a long time. But 40 years, and I've seen every drug trend you can imagine. I've seen the pot trend. I've seen the acid trend. I've seen the methamphetamine and the cocaine. This today is not a trend that we're seeing. There is no more trends right now when it comes to drugs. It's life or death. It's live or die. It's get sober or die. That's what it is. And I keep saying that to people, and they freaking don't listen, and they keep dying. I mean, you don't know how many people I've talked to, just like I'm talking to you, and said, if you keep doing this, you're going to die, and they die.
Well, it's like we've talked about before. Nobody thinks it's going to be them. They never think it's going to be that person. Every day when I cover crime over in the newsroom, the biggest thing, attitude, we always tend to hear of in terms of criminals, which is not the same as an addict.
Right.
I would like to say that very clearly right now. Those are not the same thing.
Right. Even though drugs can
be illegal and can be involved in crime.
Exactly.
But addiction in and of itself is a disease, not a crime, and that needs to be treated, not punished.
And that's the hardest freaking thing for me to convince somebody is you got a disease.
It's a disease. I think the way to clearly look at it is look at, I'd say, the most common, least socially stigmatizing addiction you can have is caffeine.
Correct.
Caffeine.
Yeah.
If you have withdrawals from caffeine, you have a headache, you have shaking, you can't function, you're not waking up. How is that different than withdrawals from some other drugs? It doesn't kill you.
And nicotine.
And nicotine, same thing.
Same thing.
You're grumpy, you're grouchy, you don't feel good, you don't want to eat, and you're just waiting until you can get out there and head over to Starbucks or head out and get your smoke break.
Right. You know, and it's different today than ever before for lots of reasons. Yeah. We already know that. And if you're watching or listening to this show, please let people know what we're going to be doing today. We have a bag on the ground here. I'm going to pull up in a minute, and it's all the look-alike drugs. I'm going to show Xanax that aren't Xanax. I'm going to show M30s that are not M30s. I'm going to show opiates that are not opiates. And we're going to test them, and we're going to show people. Ooh. These are the pills that people are dying from. In fact, the ones that I have with me today, I confiscated from people. And everyone that I confiscated from had to be Narcan back and ended up in rehab. Some twice in one day.
Which,
So
for
I'm gonna
your
give-
listeners, Narcan is the substance that essentially stops
The
a overdose in its tracks.
In its tracks. So we're gonna show these drugs in a couple minutes, but I want to give people time to tell people to watch this or listen to it.
Mm-hmm.
So, but it's different today for a lot of reasons. Number one, it's harder for people to even go through detox. You're talking about detox.
Yeah.
Fentanyl's a game changer. Because if somebody came in and they were on opiates or benzos or that kind of thing, we can give them medication. And immediately they can start to feel a little bit better.
Mm-hmm.
When it comes to fentanyl, you can't. It's a day and a half to 2 days before you want to give them any kind of detox meds because you'll throw them into immediate withdrawals. So if somebody comes in and they're hooked on fentanyl and they don't even know it,
Mm-hmm.
and you give them Suboxone or Subutex or whatever it is, they're going to be sicker than they were without it. So you gotta give them some time to it go through their system before you can give them medication. And that's the most scariest thing in the world for any of these guys, because coming off of these drugs, how do you say it? It won't kill you, but you'll wish it did. The pain is so bad. You get the nausea, the muscle cramps, this cold and sweats, the runs, you throw up, your bones hurt, your skin hurts, your hair hurts.
Yeah, at that point, it hurts more to come off it than just to stay on. And then going back to my original point, which is that nobody thinks it's going to be them.
Right.
Nobody thinks that they're going to be that statistic. And unfortunately, as we've seen just here in Santa Clarita, everybody's becoming a statistic. You were just talking about two people who are in their mid-20s or so. They're my age. And you're talking about a mother who has lost both her kids to something that is entirely preventable.
It's so sad. And if you read The Signal, I mean, there's another one. It's everywhere.
Every day we're reading about another overdose. If we're lucky, it's not fatal.
Yeah. Well, thank goodness for Narcan. And Narcan, what Narcan does, it's a nasal spray.
Okay.
And everyone that has a person that is using any kind of opiates or any kind of drugs right now, this should be in their home. I know that we pushed it really hard. We wanted all schools to have it, and we've accomplished that. The press conference we did, and then everything exploded and it started mushrooming. So Narcan's in all the schools and first responders, everyone has it. But sadly, this needs to be in every freaking house.
And this is available over the counter, right? I could just run down to any of these drugstores.
Any of those places you can buy it, and a lot of libraries and rehabs are giving it away.
Okay.
So and your doctor can write a prescription if you need it, but you get it without it. But it's super important. It's a life-saving drug. And then a lot of people they're going, well, if we're passing out Narcan, we're promoting drug usage. No, you're not promoting drug usage. You're saving lives.
You're promoting the prevention of death from overdose.
Say that again.
You're promoting the prevention of death from overdose.
I'm going to use that line. I like that because that's what this does.
I'm going to compare this to something. Today, I am having to write a story about suicide prevention. One of the big things that all of the major organizations, including the CDC, suggest is that talking to someone about suicide does not put the idea of suicide in their head. And it's the same thing with something like this.
So true.
You're not putting the idea of using drugs in someone's head by educating them about the dangers of it.
Right.
If you do it the right way, I think we've all seen how the DARE program
of course
didn't. It brought more ideas to people. But
right.
teaching people about how to save others from overdose, that's not encouraging overdose. That's hopefully encouraging more lives being saved.
And you know what? And these aren't the ones that are dying. Yes, they're addicts, but not all of them. A lot of the people that are dying are kids that are experimenting with drugs. And let me get the message straight right now. Experimenting with drugs is just as deadly as if you're an addict. There is really no such thing as recreational drug usage anymore or experimenting with drugs, because it's a ticket to death.
Yeah, you were telling me last week during one of our other special episodes because of an unfortunate another overdose.
Yes.
Wasn't it like 6 out of every 10 pills?
6 out of every
is
10
fatal?
pills today that's on those streets have a lethal amount of fentanyl and has the ability to kill somebody.
Goodness gracious.
Yeah, it's crazy. I was reading a text message of one of the kids that died. And actually his girlfriend said, please be careful. He says, I know what I'm doing. And he took a half a pill, and his father found him dead.
And that is exactly what I'm talking about when I say nobody thinks it's going to be them.
No.
They all think that they know what they're doing, that they're not going to get that bad pill.
Right.
But,
But you know what? Yes and no. Nowadays, it's changed a little bit because people that are addicted to fentanyl and know that they are, they call me and they say, I know I'm playing Russian roulette. I'm scared every time I stick a needle in my arm, or every time I smoke it, or every time I whatever it, you know. But they're so afraid of the detox, and they're so hooked on this thing, and the addiction is so powerful that they're afraid to even come in to get detoxed. So it's insane what's going on right now.
So I've been covering fentanyl for a while, but I know that it is an opioid. I know that it's stronger than morphine.
50 to 100 times.
Goodness gracious.
Yeah.
What other drug on the street would you compare it to in terms of effect?
It's opiates.
Okay.
But it's one of the most powerful opiates in the world, or drugs in the world. It's used for surgery and for extreme cancer patients with extreme pain. That's what it's used for. You know, these drugs do have a meaning, and people, we don't want people to feel pain. And that's kind of where we got ourselves in trouble, too, because right before the pandemic, we had an opioid epidemic. And no one talked about it. The pandemic came in, it was like pushed aside, but people that were used more. And then what happened is the Medical Association and DEA went, whoa, we're creating addicts. Stop writing prescriptions. And bang, just like that, they stopped writing prescriptions. So people that were going to the doctors, or dealers that were sending people to the doctors and getting 90 pills with 3 refills, that went away right in the beginning of the pandemic. Just stopped dead.
Yeah, when you're talking about a major time where people are looking for support, they have a major need for mental health. And I think anybody with kids understands that if you cut something cold turkey, that doesn't mean that the desire for something's gone.
The supply was gone. The desire was bigger than ever. The demand was higher than ever. We had, like they said, we had an opioid epidemic. All of a sudden, we stopped it.
Yeah.
So where's people going to go?
Basic supply and demand. I was a business major. Yeah. Where are you going to go? If your local place where you normally buy things suddenly doesn't carry the product you like, you're going to shop elsewhere.
We have to.
And somebody else is going to come into the market. And from what you've said, that's exactly what happened.
You had to, because you're addicted. And if you don't have your drugs, you get dope sick. If you get dope sick, it's horrible. So what had happened is fentanyl got into the picture. China went, whoa, what an opportunity. And they were shipping a boatloads of it to here. I know people that actually got sober in our program that was dealing. They were getting it from the black market and pressing pills. DEA did a really good job of slowing that down, but China just sent it to Mexico. So it went from China to Mexico, and they're making tons of pills. I'm going to show you in a minute. And they're coming into California and all over the country right now. This is not a California deal. They say Santa Clarita is a hotbed for deaths, I believe, only because we share our numbers correctly. Yeah. But it's everywhere right now. It's in everything. I want you all to hear that. If your child is experimenting with any drug, fentanyl's around.
Yeah, and I think that's one of the major...
That's cocaine. That's methamphetamine. We had a couple girls, remember, in Santa Monica, that overdosed from fentanyl taking ecstasy.
Yeah. Yeah, every time you come in, you're telling me about another, I wouldn't say safe, but what people think is okay for them to try and okay for them to do just once, and it won't matter. But
Jay,
because it's tainted.
Tell me one drug that's okay to use and experiment with.
None of them.
None of them. And the message that we're giving our children today is fentanyl is bad. Fentanyl kills. Wait a minute. That's a great message, and fentanyl is bad, and fentanyl does kill, but these people aren't buying fentanyl. they're buying crystal meth. They're buying oxycodone. They're buying Percocet. They're buying Xanax, and they're dying on fentanyl. So the message that we better be giving people today is all drugs are deadly. You never know what you're taking. Don't play with anything because it's at best Russian roulette today. And it's going to get worse. It's not going to get better. So what I'm going to do is I'm going to show you. I'm going to show you what I brought. So watch closely on this one. So here we got in this bag, and I'll explain it to you. This here is black tar heroin in a hypodermic needle. The person that bought this had no idea how powerful it was. It's mostly fentanyl and some heroin. So when this person shot the dope, he was actually found on a toilet bowl with the needle in his arm. And thank God the people around him had Narcan and they brought him back to life. Ambulance came and he's actually sober now almost 9 months. So this guy's life got saved because of Narcan and almost died because of fentanyl. Wait a minute, it was heroin, Bob. Nope, fentanyl. This here, we'll get a little bit more into this right now.
I'm going to move some of this.
Yeah, actually, this is what I want, so we'll show it to you. And before I do all this, I'm going to put some gloves on, just because I know people say, well, you can't get sick touching it. Well, that's not really true. If it gets into your system, you can get sick.
Yeah, something we hear a lot is about like when police officers are doing a bust and they come in contact with fentanyl, about how some of them will have a reaction to it. What is the actual susceptibility of that?
Well, first of all, I don't think the police are faking. I mean, if they're holding fentanyl or opening a door of a car and it blows up and they inhale it and they're falling down and having to be Narcan, you might want to think that that's real. So it's always better safe than sorry. Precaution's better than worrying about what happens. So right here, this here is Xanax. It looks like Xanax. You can't tell it apart. The person that I got these from, he overdosed, listen to this, twice in one day from these pills. The father found them in his bedroom. Ambulance came, brought him back to life, went to the hospital, came back and did it again. Same pills, same guy, twice in one day, had to be Narcan back. And can you see this? I want people to see. You cannot tell those apart. They look like Xanny bars. They are not Xanny bars. They're just lookalikes. They're made from a pressing machine, and fentanyl is what's the main ingredients of this pill. One guy, twice in one day. Is that scary enough? Scares me. All right, let's just go a little bit more in the bag here. Here we got more Xanny bars. I'm not going to spill them out, but they're more Xanny bars, and these are not Xanax. These are, again, pressed pills bought on the internet, made to look like it.
Which I just want to compare that real quick for the camera.
Oh, yeah.
This is what a Xanax bar is supposed to look like.
Oh, wait a minute. Looks like that.
It looks almost exactly the same, doesn't it?
It's going to be awful hard to tell it apart, unless you have them right there to compare. And then you still might not be able to.
Yeah, I believe I don't know if it's the CDC or the FDA website. They actually have a whole page of side-by-side comparisons.
Yep.
I'll be actually talking to the microphone and repeat myself. Either the CDC or the FDA actually has, or DEA, I believe. I don't know. I have to be on all those websites so much. They all kind of blend together for alphabet soup.
Yeah.
They have side-by-side comparisons of real pills versus fentanyl mock-ups, and they are nearly identical.
Yeah, you can't tell. Here, this is was taken from a patient last week, actually 2 weeks ago. This is cocaine. I have not tested this, but it's probably, well, I don't know if it's real or not. It's easy to find out, but anyways, here's where, when you find stuff like this, let me find what I'm looking for here. When somebody is smoking or inhaling opiates, or heroin, they put it on tinfoil or on a spoon. They burn it and then they inhale it. So if you're finding things like this around your house, torches, that's what usually these are for. They're not buying torches because they smoke cigarettes. It's either they're smoking heroin, opiates, or
Making creme brulee.
meth, meth pipes, or meth. So that's kind of where that's at. So if you're finding this stuff around, this is not. It's not for incense. If you're finding this around, burnt tinfoil or spoons, you know that it's not because they cook food. It's they're either smoking heroin or meth or something with it. So it's pretty interesting stuff. And again, lighters for that. So this is some pretty deadly stuff. When we come back from commercial, I'm going to test some drugs for you so you can actually see what happens when you test them. So we'll be right back. This is the Action Drug Rehab Hour. I'm Cary Quashen along with Jade today. Thanks. Welcome back to the Action Drug Rehab Hour. I'm Cary Quashen. I am your host. This is probably one of the most important shows we've done. We've done many, many shows. I think every show we do is important. But this is information that can save people's lives. And y'all better, if you're watching this, tape it, go on the website, share it, let people see it. Because right now, this is the stuff that people are buying. This is what's killing our children. Not just our children. This is what's killing everybody. Anybody that's using drugs has a very potential to die from this thing, and it's Russian roulette it back. So, Jade, why don't you tell Louie what we're doing so he can catch up?
All right. So what Cary is going to do is he is going to actually test some of these drugs that were seized that he has brought with us today as a part of his fun little show and tell to see whether or not they actually have fentanyl in them. And so far he's pulled out a couple of different items. He's pulled out what looks like Xanax bars. They are identical to the ones that I was able to find on the DEA website as an example of real drugs. And now you're pulling out these little round blue pills. What are those supposed to be?
M30s.
Which is what?
The most sought out pill there is, which is Oxy.
Oh, okay.
Okay.
So, again, what happened is doctors were writing these for pain, and people were sending dealers were sending people to the doctors. They were getting prescriptions. People that were really in pain went to the doctors and they were getting prescription. Right when the pandemic came, doctors stopped writing them because we knew we were in an opioid epidemic and they didn't know what to do, so they stopped, which opened the door, as we were talking about earlier, for China. And China, what was doing on the black market, they were shipping tons and tons of fentanyl to this country, and people were pressing them. Making pills like these, the Xanax that are on the table that we showed you earlier. DEA did a pretty good job of slowing that down, but not to Mexico. So they went right to Mexico, and Mexico is pounding these things out. I mean, if we watch the news every couple of days, we're seeing 100,000 pills got caught. But if you imagine what's getting caught, what's getting through. And the sad thing about 6 out of 10 of these pills, this is right for the DEA's deal, has a lethal amount of drugs that could kill you. So it's one of the most deadliest things we ever seen before. I've been dealing with drug abuse and helping people get sober for 40 years. I've never seen nothing like this. I've never seen so many. When we started the show, I talked about a poor mom that sent me a text on Facebook about 2 weeks ago that her son died in October. I got another text message on Friday that her daughter died December 10th. Yeah. From the same freaking drug. How do you deal with that stuff?
I have 2 questions for you on that. How many of these related back-to-back overdoses are due to the fact that the second person is trying to cope with the death of the first one, so they turn to drugs and end up killing themselves? Is there any statistics that you have that relate to that?
Well, a lot of times brothers and sisters that are using, they're just using. But to answer that, I've seen people absolutely use more drugs because they didn't know how to cope with losing somebody. Yes. I've actually seen parents that turned to alcohol because they didn't know how to cope with losing kids. I mean, imagine.
Yeah.
Your brother, your sister, your uncle, your mother, your kid, your husband, your wife. Imagine waking up finding they're dead.
Yeah, and I think this goes back to our initial point from earlier in the hour, is that addiction in and of itself is not illegal. It is a disease and is something that needs to be treated
Like a disease.
like a disease.
Correct.
And addiction is something that can involve illegal substances, but addiction is something that should be treated with, at the very least, empathy, even if it is a very difficult situation and sometimes hard decisions have to be made. At
Well-
the end of the day, it's because someone wants to feel better.
Yeah, exactly. And you also got to remember, statistics say 6 out of 10 Americans will have a drug or alcohol problem in their lifetime. Now, such a small percentage of that will actually reach out and get help, but 6 out of 10 people in this country will have some kind of drug problem. Meaning it could be benzos because they have anxiety, it could be opiates because of pain, or it could be street drugs. But 6 out of 10, so it's something that us turning a blind eye and not paying attention to is absolutely the wrong message. So, but what I'm going to do now, just to show people, this here, let me move this. This here, I'm going to crunch up this M30 right here. So I'm going to do it carefully. So what we're going to do is we're going to crunch it real good. And we're going to look. It looks pretty crunched to me. And then we're going to pour it in here.
And that's the only way to test it.
Yeah, you don't want to take it.
Well, no.
That's not the
I
right
mean,
way
you can't just put the pill on that strip to get an accurate read.
No, this is the only and best way. I'm going to put this here.
Which for our listeners who are joining us who are only on the radio, what Cary has done is he has crushed one of these little blue M30 oxy pills with a spoon, and then he poured the dust into a paper cup, and he's now pulling out a little test strip. He is gloved, and he is being very careful about contact the entire time, just out of precaution. How long do these test strips normally take to react?
No, just a few seconds, just a minute or so.
A minute or so?
Yeah, this is not the one I normally use, so.
And that fine dust, that's not enough. There's no danger to that. Just for like law enforcement, because I know in the past, I know Jade talked about this with you a minute ago, just the dangers that law enforcement have to deal with testing narcotics. That from time to time you'll see it on the news, a deputy or a police officer, even a paramedic or EMT are exposed to fentanyl and have to be taken to the hospital. Is it as simple as them just doing a drug test like this? Like how dangerous is that process in itself if you're
Well,
dealing with fentanyl?
As you see, I'm being very careful. I got gloves on. I crunched it up. I put it in here.
Yeah, you're not holding it up to your
I'm
face
not holding it up to my face. What? If you remember, the last officer that overdosed or needed to be Narcan opened up a pile and it blew into his face.
Yeah,
so
kind
he
of poofed.
inhaled it. Of course, that can do it. That's the same as if you inhaled it yourself. I would just. I mean, there's all kinds of people saying, "Well, it can't happen. It can't happen." But if you're watching and if you see a deputy going down because they touched it, I don't think they're faking it. So if you look at the test kit, you'll see one line. One line means that this pill is fentanyl. It has to have 2 lines for it not to be. And if you look at this kit, see the line is 1. Can we see that? This is fentanyl. It has nothing to do with oxy or an M30. This is fentanyl, period. End of subject.
Which I just want to pull up here for our camera as well. I pulled up the comparative picture by the DEA of a real oxy tablet compared to a fake one. Which could I have our board op put that in front of the camera? Look at that. Top one is real. Bottom one is counterfeit. And you can take a look at what Cary's holding. All those pills look pretty much exactly the same. And I believe you talked about before, Cary, they're using very similar equipment to create those pills.
Yeah, you could actually, you know what's really pathetic? You could buy a press kit online. And you can make anything look like anything. So but remember that the people that are using, the people that are making these pills, they're not chemists. They're not doctors. They don't have any degrees in this thing. They're mixing it the best they can. And if, let's say, see these pills here? If 5 of these pills, and they're saying 6 out of 10, let's say 2 out of these whole batches have a lethal amount.
That's still 2 people dead.
That's still 2 people dead.
Too many.
Too many.
Yeah.
So you never know which one of these pills,
How many pills are in that bag, would you estimate?
50. You never know which one of these pills or these pills is the one that's got that much fentanyl in there that can kill you. You just don't know. Again, the person that was selling these overdosed. His father had to give him CPR until first responders got there and Narcaned him back. Kid got lucky.
I'd say. And
super lucky.
let me ask you this, Cary. In previous interviews that we've done with you, stuff that I've done with the J team, who's part of the Santa Cruz Valley Sheriff Station, who deal with a lot of the drug overdoses that happen, especially with teens. I'm sure you work a lot with them.
Of course.
They told me that they have had people that they've come in contact tell them that if we don't overdose, the drug isn't strong enough. So there are, from the interviews that we've got from these people, which is just crazy, that there are people looking to overdose. And I have a feeling that you would say those are your drug addicts. And then you have people like what you talk about, where there's these people that are just simply trying to buy some kind of small tablet just to cope with something, but they end up taking fentanyl. So let me ask you this. With that being said, what are the intents of, maybe you don't know the answer to this, but what are the intents of the people manufacturing? Because if you're someone like me who is trying to make a product, you want to keep having your customers come back.
Correct.
So what's the point of making these look-alike Oxycontins who are probably not going to go to a drug user? Mm-hmm. They're going to go to an innocent person. What's the point? What's the point of the drug makers doing that if they're going to get a one-time customer who's just going to die from it? And now they don't, I'm not trying to promote the resale, but they're not going to have a continuous customer.
Simple answer. You ever make chocolate chip cookies and you put too many chocolate chips in one? Mm-hmm. Wasn't intentional, but it sure tastes good. These guys are not chemists. If they mix it just a little bit too much by accident, somebody dies. They're not trying to kill anybody when they do this, but the risk, it's they don't know what they're doing.
And the reward outweighs the risk. The reward is that it's stronger for cheaper, and they make money.
For cheaper, and they make money. And a lot of times you'll hear from the people that are buying, the addicts, right, or the users. They'll say they're in the old days they were running and scared of fentanyl. They're looking for it now because, like you said, it's stronger and better. But they're also thinking that they're smart enough to be able to fool the drug or get up on the drug. Like, I'll use a quarter of a pill, and if I need to get more, I'll use another quarter. And that other quarter, it could be the one quarter that kills you. So nobody's smarter than this. You can't, because you can't see what's in it.
You can't negotiate with a chemical. You can't trick a chemical. It's going to do what it's going to do.
But they're actually thinking they can negotiate with it. I'll take a quarter. I'll take a half. I'll use less. And then a lot of other things, a lot of people that are dying are also people that's been clean and sober for months. Mm-hmm. And what happens is they decide they want to get high one more time.
And they use the same amount that they used to use before,
no,
and they don't have that tolerance?
They use a little bit less, but their mind says, I'm not high enough.
It's not the same.
It's not the same, so they chase that high. So what they do is they'll use a little bit less and say, I'm not high enough. I need a little bit more. Now their mind needs it, their body can't take it. So their mind wants it, their body says, okay, buddy, you're dead. And that's the way we're losing a lot of people. They also, another major, they're saying 18 to 45 this is the number one killer, accidental overdoses. Imagine that, 18 to 45. Number one killer is right here. This is it, on this table. The number one freaking killer.
Now, do you think fentanyl is just as strong today as it was 20 years ago? And do you think in another 20 years it'll still be as strong, or do you think it's going to continuously getting stronger and more
Well,
deadly?
people, I mean, let's face it, nobody wants anyone to have pain. So these drugs, not these, because these are bootleg.
The drugs as they were originally created and is intended to be used in a medical situation.
Yes, I mean, we don't want people to feel pain. So, of course, I mean, these are fentanyl patches. For
Yeah.
somebody that has excruciating back pain and that kind of stuff, this is good. But what addicts are doing is they're soaking them, they're drawing it out, they're shooting it, they're sucking on it, they're doing whatever they can to get high. So there is always going to be a need for these medications. In fact, I think one big mistake we made, and people might think I'm crazy, but I think we need to allow doctors to write freaking prescriptions again. Because what we did is we stopped it. They're afraid to write them. And so what's happening is people are going on the internet buying these fake pills and dying. So we don't want people to feel pain, and we want doctors to be able to be doctors and do what they need to do. We have everything today we need to watch what doctor's writing too many pills, who's overprescribing. It's all on the internet.
Yeah.
If you go to a doctor today and you want a prescription for anything, they're going to type your name in a computer. It's called the Cures program. And they're going to see every prescription you've already got.
Oh, make sure you're not doctor shopping.
Exactly. So you cannot get away with doctor shopping anymore. It's not possible. And they also know what doctor's writing what. So I think that it was so bad with the opioid epidemic that we went all the way to this side and said, don't write them anymore. So it's a whole approach that we're going to have to do. A lot of education. There's going to have to be serious things on crime. Dealers need to go to jail. If somebody dies, they need to be convicted for murder, because this is poison.
Yeah.
And we need to allow doctors to be doctors. So it's a whole approach that we need to start doing here.
So do you feel, though, that in the next 20 years the potency of fentanyl will be higher?
I think in the next 20 years there'll be different pain medications, if it's fentanyl or not, that's going to be stronger. Yes.
So in 20 years you feel that fentanyl will just be the past. Now we have a new.
Yeah, who knows what's going to happen. They're actually coming up with stuff now that you can't even test for fentanyl, and we're afraid that Narcan might not work.
Oh,
So
my gosh.
there's all kinds of stuff that's coming out right now that is getting pretty scary. So we need to definitely pay attention.
I had a question for you,
Yeah,
Cary.
yeah.
So something that I've been thinking about here now, a topic that's been kind of bandied about, especially here in California, these safe injection
Hey, isn't he a
sites.
celebrity? Doesn't he have a show?
Yes, he is. He is the host of our new sports show.
That's right.
I
yes.
know. What a great show that is.
Thank you. I appreciate that.
Yeah.
But, this idea of a safe injection site, quote unquote, I don't know the legitimacy of them at this point, but
Yeah.
what kind of message is that sending, especially to impressionable teens and kids in their 20s, that
I've been
you
I've
can
been
go
interv-
somewhere
yeah.
and do this, quote unquote, safely? It's almost like
I'm concerned, like just base level, what's the liability associated with that when you have so much fentanyl involved?
Everything about everything is scary right now. I think what's going on is people are panicking and don't know what to do. So they're saying, if we give them needles and we give them a safe place with medical people on board, then we'll save lives. What do I think about that? I think that it depends on the message. If we're promoting drugs, if we're saying it's okay, use here, you're safe, it's bad. If they're doing something like that and they are demanding that you're in some kind of counseling or treatment and you're offering rehab, it might be a little bit different. But just to have a house where they can come in and use, that's scary stuff. Treatment has to be offered or pushed down their throat a little bit. That make sense? Does that answer your question? Okay, good. Do we need to take a break, or are we going straight? You want to take a break? All right. Jade, why don't you take us on a break since you're the superstar?
Alrighty, we'll be right back in just a couple of minutes after this ad break. You can tune right back in at KHTS FM 98.1 AM 1220 and find out more at hometownstation.com.
Welcome back to the Action Drug Rehab Hour here on KHTS. I'm Cary Quashen. I got Jade and Louie. Wow, I've got like royalty in this thing. And Matt, oh my goodness, what are we going to do?
You got basically the full KHTS crew in here.
I know. I need your autograph when we leave. No, but I think that we were just talking on commercial break. This is information that needs to be out that can save lives. This stuff here, I mean, again, let's show it. This is deadly. Everything on this table is deadly. You got Xanax pills, they're fentanyl pills. We just tested them. We got Xanax pills, not fentanyl pills. We got Oxy, not. They're fentanyl pills. This is what people are buying on the internet. This is the only thing they can buy on the internet.
So for those of you who aren't watching our Facebook Live, our desk between the microphones is scattered with bags full of what look like
I forgot not everybody
prescription
watches
pills.
this.
Not
But they
everybody.
can watch this, can't they?
They can watch us on Facebook Live, where we are live right now, and you can see pictures and images of everything that we have laid out. We have a crack pipe, we have spoons, we have tinfoil, we have a little burner. I can't think of the name for that besides that right now. Perfect, a torch. Thank you. We've got it. It looks like we could start our own business, right?
Yeah, we probably could with this stuff, but I think we won't.
I don't think so. We've
No.
also got actual medical fentanyl patches and Narcan, which can be used to stop an overdose of fentanyl in its tracks. And the reason that Cary has brought all of these in today is to show everybody just how dangerous these fake counterfeit is actually a better way to say it. It's because fake implies that it's not a good copy. They're counterfeit. They look real. We were looking at side-by-side images of real oxy pills compared to these counterfeit ones, and they are identical.
Yeah.
They are absolutely identical. And
They're sure not with ingredients, though.
no, much, much more dangerous. But you were just about to bring up another substance that I think is kind of flying under the radar a little bit. I have seen a couple of headlines relating to how dangerous it is, but I don't think it's really hit most people's awareness just yet.
It's gonna, and it's hit awareness in other states where it's illegal in many states right now. But if you go into any of the smoke shop, you'll see signs saying kratom. And it's real simple. It comes in a powder. It's from a plant or capsules.
Mm-hmm.
It looks like vitamin stuff that people put, or tea they put in their drinks. And it's a derivative of opiates. So people are, especially recovering people, were using it because it says it gives energy and it does this, and you can't test for it. Well, guess what? Joke's on them, because you can test for it now. It's a special test, and we have that at Action, so we can test. But the thing about kratom, it's just as addictive as opiate. The same thing, and the detox is just the same.
Which something I want to mention is that in the world of the FDA, and which is our Food and Drug Safety Administration, supplements are a weird gray area. Very strange. There's a lot of things that are not technically, legally, medical as they are. Supplements, so they're not technically safe. They haven't been said that they're safe, but nobody has ruled that they're unsafe. And that's where supplements kind of fly into that gray area. So
Right.
I'd be careful of that in general. And I think that's where this is really starting to be so insidious.
Yeah, it says don't take it if you're pregnant, but a lot of these supplements actually say not for human consumption, and they still take and they sell them, and people still do it. This show, you can listen to it on the KHTS website. You also will be able to. It goes on. They put the actual film on in a couple of days, right? It takes a couple of days.
Today or tomorrow.
Okay.
It'll be up on our YouTube.
Okay, it'll be on our YouTube. Usually it takes about 2 or 3 days, I've
Yeah.
noticed. Anyways,
Okay.
or you can Facebook friend me. It'll be on my Facebook, and that's Cary Quashen, CaryQuashen, and hit me up on Facebook. Also, I apologize because I posted this, and there were people that wanted to call in today, and we just went on a roll, so I apologize for anybody that wanted to call in. That we were not available to do that. I think next time we'll have a show and we'll leave it open for call-ins. So again, my apologies. And again, you can watch or listen to this show on the KHTS website. You can check the KHTS's Facebook. You can go on Google. You can or Facebook friend me at Cary Quashen on Facebook, and there you go. What else can I say?
Oh, well, we have a Facebook, Instagram, and Twitter. That's all at KHTS. You can find us there and find out more about Cary and specifically this show and see any of our previous specials on the dangers of fentanyl and THC and any other substance that is
Yes,
plaguing
and hey
this
guys,
area.
if you're using any of these drugs and you think you have a problem, you do. Please get help. Call us at Action, and if you don't want to call us at Action, call freaking somebody. Till next week, thanks for watching. Thanks for listening.